Hi everybody, my name is Hannah Dial and my PowerPoint is over child abuse in America. Child abuse in America has become, we don't talk about it as much as we used to, but it's still here, it's still happening, and it's in ways increasing. So there are multiple types of child abuse, physical abuse, emotional abuse, sexual abuse, and neglect. So I know a lot of people think about child abuse, it's more on physical or sexual abuse. And yes, that's still happening today, don't get me wrong. But another issue is the emotional abuse and neglect. Emotional abuse can be the way you speak to a child using profanity, curse language, um, or just bullying them in a way. It could be from siblings, parents, any family member really. And then neglect, it's not doesn't just mean they're being left at home by themselves or not and maybe not even being fed, but neglect can just be, say your kid drew you a picture and they go, hey mama, hey daddy, I drew you a picture, and instead of looking at it they just grab the paper and throw it. That's a form of neglect, and this is a real thing that more today, that parents are more focused on TV, cell phones, or friendships outside of the family, and just drama, and they're not family focused. And that is a big factor in child abuse, is not being a family focused individual. Because when you become parents, you're no longer just a husband and wife, or wife and wife, or husband and husband. It's a big issue when families are focused on everything else but the kids, and that ties into neglect, and it can psychologically affect the child later on in life. And of course, we do understand the physical abuse is your typical, maybe it's hitting or burning cigarettes on them, anything along those lines. And of course, we do know what the sexual abuse could be. And as well as around the range of the child when abuse typically starts is around 3 to 5. It does happen in earlier years. It can happen, newborns, but typically you'll start seeing between 3 and 5 that neglect, when they're talking and they're walking and they're doing things, they want to be with family, they want to do stuff. Maybe the parents don't want to do stuff with them and they yell at them and hit them, or just lock them in a room or say, go play outside, we don't want to talk to you, stuff like that. But in all reality, child abuse can occur from anywhere between newborn to 18. I mean, it's something that, it's one of those things that happens and it shouldn't happen. And then we have effects of child abuse, and there are so many. I just listed a couple that you can get, just that it really mentally, psychologically, physically can affect the child. So for starters, there's depression, anxiety, you can have mental disorders, bipolar. I put the ID where, as some people have seen the movies Split, but that's not necessarily the case. It can be having multiple personalities because that trauma affected them when they were younger, and they built these alternative identities that help shield him or her from that pain and that trauma they experienced. And that's when you start getting that identity personality disorder. You can get cognitive disorders, more on the lines of educational wise. They can be not as advanced as maybe some of their peers. That is a big issue, is because that trauma has mentally slowed them cognitively, I apologize, and they will have emotional outbursts in class or behavior disorders, and those are all symptoms of child abuse. You need to be more careful and look into it, not just be like, oh, that child is being aggressive or having emotional outbursts. You need to consider the whole picture of what's causing the emotional outbursts instead of just writing it off, oh, this child is having some behavioral problems, when in all reality they're being hurt at home. And then you can have economic disorders where they're going to have financial problems growing up. It can affect how they spend their money. Maybe they get into alcohol or drugs or something that will take all their money instead of focusing on the big picture stuff like putting towards retirement, trying to get a job, buying things that's of necessity and value, or even maybe buying something to treat yourself. It can cause those economic disorders. And then there's risk of getting into that criminal life, Sometimes it happens. You grow up in that atmosphere and it's hard to break the cycle. And of course, there's always that risk for suicide. So there's some ways we can prevent child abuse, and that's the educational approach, and then there's the family-oriented approach. So the educational approach, it's more on the lines of you're in the classroom setting and you have that teacher one-on-one action, and this is mainly if you know that child is in that atmosphere, but that one-on-one, really building that teacher-student relationship and working on them educationally. And here's some more, this is talking more on the lines of that student-teacher relationship. And then there's that family-oriented approach. That's whenever you kind of have somebody maybe on the outside and that works with those kids and it helps, build those relationships, and you can start even putting together like workshops so you can start teaching the signs of child abuse and all those things and how you can start preventing it and even treatment options to get, a better approach. Lastly, are there any questions? Is there anything that I didn't add that maybe should be added? And maybe some statements. I'm open to having input. That'd be very helpful. And then lastly, here's some references that I found on the SFA library. And thank you guys for listening.